Are articulation errors always a speech sound disorder? Imagine a young child saying wabbit instead of rabbit or thun instead of sun. These are common speech patterns in early childhood. But are they always a problem? Let's find out. Articulation is how we physically produce speech sounds using our lips, tongue, teeth, palate, and breathing system. When someone has trouble making a specific sound correctly, we call it an articulation error. These errors happen often in young children as they learn to speak. For example, a toddler might say wabbit for rabbit or dude for food. These mistakes are normal during speech development. A speech sound disorder is a broader term that includes any difficulty with producing or using speech sounds properly. It covers both articulation disorders and phonological disorders. Articulation disorders involve trouble physically making sounds, while phonological disorders relate to understanding and using sound patterns of a language. Usually, these disorders are diagnosed when errors last beyond the age when most children master those sounds. Now, to answer the main question, are articulation errors always a speech sound disorder? The answer is no. Most young children make articulation errors as part of normal development. It is expected for children to make mistakes as they learn to control their mouth muscles and master new sounds. These errors are only considered a disorder if they continue past the typical age and interfere with being understood. For example, a 3-year-old saying tup instead of cup is usually normal. But if a 7-year-old still makes this mistake, it might indicate a speech sound disorder. Speech-language pathologists look at whether errors are age-appropriate or signs of a problem. They assess if a child's speech is clear enough for others to understand easily. In therapy, children with articulation errors might do exercises to strengthen their mouth muscles, practice specific sounds, and learn strategies to improve clarity. Early help can prevent communication issues from affecting school or social life later on. In summary, articulation errors are common in young children and do not always mean there is a disorder. They only become a concern when they persist beyond the typical age and affect communication. Speech-language pathologists play a key role in telling the difference and helping children speak more clearly.